Childhood obesity is an alarming trend here in the States, and it seems as the years roll by, the worse the problem gets. And today we're going to talk about that because new treatment guidelines are out that really they go hand in hand with what this disturbing obesity trend is shaping up to be. A lot of people are calling it really extreme. And so today, to help us explain all of that to us, is Dr. Vanita Rahman. She, of course, is a friend of the exam room from the Barnard Medical Center. Welcome back to the program, Dr. Rahman.
Thanks so much for having me, Chuck. Always great to chat with you.
I was speaking with somebody a little bit earlier this week also about these new childhood obesity guidelines and one of the treatment guidelines. And it really is. We're going to get into what they actually are here momentarily. But before we do, I mean, let me just ask you, just as kind of a preview here. Do you think that we are going too extreme with some of these treatment plans that are being laid forth for kids?
You know, Chuck, I do. And I think the data I'll share sort of speaks for itself, that we could do so much better. We could be heading in a healthier direction for everyone.
All right. So let's try to paint that picture pretty clearly now so people can understand. It's like we really are in a jam when it comes to our children's health. And of course, then that lays the foundation for a really troublesome health wise adulthood. You carry those diseases with you into adulthood. Matter of fact, you plant the seeds as a kid and then they grow into full blown diseases as you get older. Let's go ahead and paint the picture. I know that you were kind enough to put together some slides, some visual
Yeah.
representatives. So if you're watching this on YouTube, fantastic. If you're hearing the podcast, go ahead and click on over to the Physicians Committee's YouTube channel. I'll put a link to that for you right now in the show description. But Dr. Rahman, right now we are looking at these slides and the title, New Guidelines for Childhood Obesity. Walk us through where we're at.
Sure. Thanks, Chuck. So these are brand new guidelines that were just published in January from the American Academy of Pediatrics. And they are about how healthcare providers can help parents and families manage childhood obesity. So first, let's really review some basics here. What do we mean when we say a child is obese or overweight? How do we define it? We define it a little bit differently than we do for adults. So for children, we say that if their BMI is in the 85th to the 95th percentile, we consider that overweight. If the BMI is 95th percentile or more, then we consider that in the obese category. Now, if a child has a BMI that's 120% of the 95th percentile, so for you math whizzes out there, you can figure this out, or if someone has a BMI of 35 or more, then we consider that severe obesity. So let me now walk you through what the guidelines are saying. Well, first they're saying that, for children, even as young as age 2, we should start recommending intensive changes in lifestyle. So food, exercise, lifestyle, these are all important changes that we know are highly effective. And the Academy is saying we as healthcare providers need to push those more. Now, of course, the problem with that approach is providers don't have the resources to do it, and insurance often doesn't cover it. So families and providers are both stuck. Now they're saying that if a child is in the obese category, at any age, recommend lifestyle changes. But then starting at age 12, healthcare providers may also recommend weight loss medications in conjunction with lifestyle changes. And so this is a very aggressive stance as far as recommending weight loss medications. And we'll get into what those are and how effective they are. And they're even suggesting they could be considered for children as young as 8. Now, for children in the severely obese category, the Academy is recommending, of course, lifestyle changes, weight loss medications starting at age 12, but also saying bariatric surgery starting at age 13. Of course, all of this is with a background of intensive lifestyle changes. So let's review, why is this an issue? Why are we even talking about it? Well, this graph pretty much shows what's been going on in the US. We see that the rates of childhood obesity were relatively stable, very low, less than 5% across all age groups. And then in the 70s, we see this pattern that the rates are increasing across the board. The blue curve is for all ages, and we see it's going up. And then we see it's increasing for children as young as 2 through 5. We're seeing it increase for teenagers, ages 12 through 19. And then for school age kids, 6 through 11. So it's increasing across the board. One of the arguments that's made is that, well, maybe some of these cases are genetic. And so lifestyle changes may not be enough. But then that really begs the question, why did our genes suddenly change in the 70s? Of course, we don't mutate that quickly. So it's really an issue of lifestyle. And the prevalence of obesity is quite high. Even preschool kids, almost 13% are obese. School-age kids, we're seeing an obesity prevalence around 21%, and then teenagers, almost 23%. So really, it's a big problem. And it's a big problem because it impacts a child's health. It impacts their functioning. It impacts the rest of their life, essentially. So we know they have a higher risk of obesity in adulthood, higher risk of premature death, high blood pressure, diabetes, high cholesterol, fatty liver disease, something called sleep apnea, which we used to just see in adults, we see in children now related to weight, polycystic ovary syndrome in adolescent girls, so their periods are irregular, which can lead to infertility, joint and leg problems, depression, and a lot of social problems, as we can imagine. Now, how do these weight loss medications fare? So let's review them. We have a wide variety of weight loss medications that we use in adults. Generally, we see that they lead to a weight loss of about 5 to 22% when combined with lifestyle changes. However, here is the catch, Chuck. After the medications are stopped, the weight gain is expected to recur. So they work while someone is taking them, but then afterwards, we're most likely to see the weight come back. The other part is we have limited long-term safety data. The longest trial we have is for a medication called orlistat, and that's 4 years. We have very little long-term safety data for the other medications. Now, lately, all the buzz has been about these two medications, and these are now the first-line recommendation for children and adolescents. And most experts now recommend as a first-line treatment a drug called Wegovy. This goes by the generic name of semaglutide. Of course, it's currently patented, so it's not available as a generic. It is an injectable. It's given once a week, and it costs about $1,600 a month. Now, let me repeat that: over $1,600 a month, and insurance does not cover it for weight loss.
Wow.
Now, how effective is it? Well, in the research that we have, a study that was done, the participants, these are children and adolescents who took this for 68 weeks, they lost an average of about 18 kilograms. So it's a significant weight. However, the study was for 68 weeks, and then the participants were taken off the medication and observed for another 7 weeks. And then when we look at the weight, we see that the weight gain starts to recur. The BMI starts to increase again. So we really don't know what happens long-term after a child or adolescent stops this medication.
So let me actually stop you there and ask you a question. I mean, this is the second time you've mentioned that once the medication stops, weight regain is expected. To me, that just sounds like really any other diet program out there. Right? The commercial ones, some of the more gimmicky ones. It just seems like with so many of these plans, you do okay while you're on them, but as soon as you stop, that weight comes pouring back on. I can't help but to draw the comparison to what it is that you're talking about with these medications.
Well, you're right on, Chuck. And we see this all the time with these gimmicky diets, whether it's low carb or high protein. people do well temporarily, but then it's often not sustainable for a variety of reasons. And even these medications are not sustainable long term. I mean, look at the cost alone. And then these are injections. And have you ever seen a child next to a needle? They couldn't run further away from that thing. So children are not really keen on getting anything poked. They're squeamish about getting a vaccination, let alone a weekly injection. And then there are all these side effects: nausea, diarrhea, vomiting, possibly inflammation of the pancreas, gallbladder disease, rare cases of thyroid cancer. So we're talking about some real side effects and a real price tag.
And $1,600 a month. I mean, which family can afford that? Raising a child, I think, is expensive enough. But then you're talking
Absolutely.
about that expense. Holy cow.
Yeah, and a close cousin of this medication is liraglutide. They're in the same family. It came out first, and it costs even more. This one costs $2,200 a month. Again, not covered by insurance for weight loss purposes. And we can see the weight loss is 4.5 kilograms at 56 weeks. That's about 10, 12 pounds. So it's some weight loss, but it's really not significant. And then again, the same issue in the study, we see that as soon as the adolescents stop the medication, we see that BMI start to creep back up. So the same issue with both medications.
Wow.
Now, there are other medications for weight loss that are used for adults, but they're really not recommended for children. They're not great for adults either, so I'm not going to go into that. Let me talk about bariatric surgery or weight loss surgery. This is the other recommendation that the Academy is making. Now, I want to explain what these weight loss surgeries look like. The most commonly done in the US is sleeve gastrectomy. So this accounts for about 80% of weight loss surgery nowadays. And what the surgical team is essentially doing is severing the great majority of the stomach. And then a much smaller stomach is left over, so people feel full after eating less. And the other common surgery that's done is Roux-en-Y. This accounts for about 20% of surgical procedures. Much more complex surgery, as we can see. Here's the esophagus, here's the stomach, here's the intestine it normally goes into. But now the surgical team is basically causing, they're dissecting out a great majority of the stomach, creating this new pouch, and then bypassing this huge pathway here and going down here. Complex surgery, a lot more complications in terms of problems absorbing nutrients long term. And then the third procedure, this is not approved for children, it's only done in adults, is an adjustable gastric band. So a surgical team implants an adjustable band around the stomach, which can be accessed externally to inflate, to decrease how much food someone ingests. Again, an invasive procedure, and having a foreign body always increases the risk of infection. So the question is, how effective are these procedures? Now, if we look at sleeve gastrectomy, which is the most common, so we're looking at baseline. This is the baseline BMI of the adolescent. Its average is 50. And then 3 years later, we're seeing that it does decrease to about 37, 38, which is obviously a significant improvement, but it's still a very high BMI. So it's not that surgery is completely reversing everything. It is helping the situation. With gastric bypass, we see the same thing, the Roux-en-Y procedure, higher BMI to start with, and then a slightly higher BMI 3 years later. Again, we're looking at an adolescent with a BMI of 40, which is still a very high BMI. So again, just want to make it clear that we're not completely able to reverse obesity with these procedures, but definitely able to help.
Yeah, and as somebody who's had bariatric surgery himself, I think that I'm so glad that you brought this up. And what I also know is that I mean, you said that this is what a 4-year comparison here, a 3-year comparison,
3 years.
3 years. The studies that I've seen more long term, granted they were on adults, show that even as the years continue to progress, even more weight regain occurs. in the majority of patients. And so the percentage of weight that's kept off keeps decreasing and decreasing and decreasing until eventually, that BMI is crept up in a lot of cases pretty close to that baseline where it was when the person had the procedure in the first place. And so, when people say that, somebody's necessarily cheating because they have weight loss surgery, I'm like, no, man, you're not. You're doing something extreme because you feel like that's what you need to do at that time. But there's nothing cheating about it. There's just nothing cheating about it. If you pull the numbers, you'll see that at the end of the day, unless you make some changes, you're going to be in the same health jackpot as everybody else.
Yeah, that's absolutely right, Chuck. And part of the research data is also confounded by the fact that many patients are lost to follow up, and then we don't know how they did. And the ones that are followed up presumably had better outcomes, and they chose to stay in the study. So it's very hard to tease these numbers out. But you're right. If people don't make the necessary lifestyle changes, they're very likely to regain the weight again. So there's still a lot of work ahead after the procedure.
And I'm telling you, Doc, in the groups that I attended following the procedure, within a matter of months, you started to see other patients who who had the surgery. I mean, they're starting to pull some of their old demons out of their bags. I never forget the day that I'm sitting there and somebody asks if they could have Swedish fish, which is a candy. And the nutritionist is like, yeah, in moderation. And you saw like this excitement come over this woman's face, and she pulls them out of her bag and she starts to eat a couple of that. And the next thing you know, somebody else is like pulling like a Sprite out of their bag, and then like, holy crap, we've got ourselves like half of a 7-Eleven coming out of various bags and backpacks. And it's just like, what is happening right now? I wasn't anywhere close to being plant-based, vegan, eating even what I would consider to be a healthy diet, but I was like, man, like that just doesn't seem right to me. It just doesn't seem right to me.
Yeah, absolutely. And Chuck, I mean, that's the real issue here is, is there a better solution? Let's get to the root of the problem here, because what we're really facing is really a food culture that's sort of setting us up to eat these calorically dense, nutritionally poor foods. And if we look at how the children in the US are eating, it's very telling of what's happening. So, if we look here in the latest research data from the years 2015 to 2016, the average child is not even eating a single serving of intact fruits a day. So imagine that. And then less than one serving of intact vegetables a day. Dark leafy greens are not even making it to the plate for most children. Whole grains, less than one serving. Refined grains, which we know are calorically dense, very low in fiber and nutrients, over 6 servings a day. Legumes, which are full of protein that growing kids need, again, not making it on the plate for most kids. And then there's the sugar sweetened beverage, and 18 teaspoons of added sugar a day. So that's a lot.
18 teaspoons of added sugar per day?
Per day, yeah.
Okay, hold on. I got to run some numbers. Keep talking. I'll be right back with you in a second.
And then 50% more sodium than kids should be getting. And then soy is not even making it on the plate. And we know that soy has such important health benefits.
So if I told you with added sugar, you said 16 teaspoons a day?
18. Chuck.
18. Okay. 18. So let's crunch this. 18 times 365. If I told you then that you're talking about 6,570 teaspoons of sugar every single year. Yeah, that's a lot of sugar. That's a lot of sugar.
And, let's remember, sugar is just empty calories. There is no nutritional value in it. And while a little bit of sugar is acceptable, but we're talking these extreme amounts of sugar where we're eating more calories in sugar than from fresh fruit a day. So it's very, very concerning.
Yep.
And then we look at data from CDC showing this is, let me just explain what this graph is showing. This is the percentage of US adolescents and adults consuming fruits and vegetables less than once a day. So we see here that almost 42% of adolescents are not even consuming fruits once a day. And same with vegetables. 41% of adolescents are consuming vegetables less than once a day. So, when people start saying a lot of this is genetic, I think we need to really look deeper at what we're feeding our kids, because that's really where the issue is. And it gets worse. In this study, the CDC included fruit juice as fruit. So it's actually, we're consuming even less. Our children are consuming even less fruits per day. And they counted vegetables to include fried potatoes. So
Is
if we got rid of the
is it true that something like ketchup is considered to be a vegetable to some, like in the school dietary guidelines? Is it true that
yeah,
ketchup counts?
yes, isn't that so disturbing?
Wow.
Fried potatoes, ketchup. This is not nutritious food. So the children are actually consuming even fewer fruits and vegetables. Now, ultra processed food consumption in the youth. This is an amazing study that was published in the Journal of the American Medical Association. And what they looked at was how much ultra processed food are the American children consuming, children ages 2 through 19. So these are children ages 2 through 19. We're looking at 20 years worth of data, over 33,000 children. And are you all ready for this? If we look at the percentage of daily calories coming from different food groups, look at how many are coming from ultra processed food. 67% of daily calories.
Mm.
That is mind-boggling. So it's really this background of unhealthy, ultra-processed foods that our children are surrounded by constantly. And what is ultra-processed food? I went to a conference recently where someone described it as not food, but food-like substance. It's so modified that it appears to resemble food, but it really isn't. It's very high in added sugar, almost 20% of calories are sugar, high in sodium, high in saturated fat, low in fiber, low in key potassium, and leads to higher consumption of calories, over 500 kilocalories per day in one study. So really problematic. And instead, we should be teaching our kids the power of the power plate, eating lots of fruits, legumes, vegetables, grains. And we see this bearing out in research. We did a study at the Physicians Committee, Dr. Kaliova and Dr. Barnard, where we see that when we compared a Mediterranean diet to a vegan diet, look at the profound difference. A vegan diet is associated with a 6-kilogram weight loss, which is significant, which is better than they got in that pharmacological study, where the average weight loss was about 5 kilograms. And then real change in body fat.
Right.
And another study here comparing vegan diet with control diet, this is after just 16 weeks. Average weight loss again of 14 pounds or 6.5 kilograms. So significant.
Would I be correct in assuming, as you were comparing that to the drug trials that we saw, that the study participants that we had at the Physicians Committee were not spending $1,600 or $2,200 a month on food?
Absolutely. And that I'm comparing it to the drug that cost $2,200 a month, Chuck, which yielded less weight loss at a significant price tag, Now, in that study, they're getting provided that drug for free, but most families cannot afford to pay $2,200 a month for weight loss medications. And it's not even as effective as simple dietary changes, which are getting to the root of the problem, and which our children could sustain long term. That benefit doesn't stop, because once they learn those healthy habits, they can carry that with them the rest of their lives. And then this is one of my favorite studies, the BROAD study that came out in New Zealand. And over a 12-month period, people lost an average of 25 pounds without medication, just by changing their diet. So these are pretty impressive results, and their health is improving. Their cholesterol is going down. Their A1C is going down. I feel that American children are just drowning in processed foods. It's everywhere. It's in the school cafeterias, but it's also at the shopping mall, at the movie theater, birthday parties, school celebrations, concerts, intramural sports. You see kids swimming their heart out, and then what do? They're eating a cheeseburger and fries. It's everywhere. Sporting events, and it's at home. So we really need to change our food culture. And I believe that instead of just trying to rescue our kids with expensive drugs with multiple side effects or irreversible complex surgeries, let's teach them how to eat well and take better care of themselves, because that is knowledge that they can carry. That's not a gimmick that they'll follow for a few months. That's a lifestyle they can always stick with. So, I think the take home message here is, yeah, we have medications and surgeries that can work, but we also have a much simpler option, food that we consume 3, 4, 5 times a day. So let's really focus on that and imagine what $1,600 or $2,200 could do to feed a family every month. Imagine what a difference that could make instead of spending that on medications short term.
Absolutely enormous difference. Thank you for sharing that with us. I think back to the bariatric surgery, which I had on my 27th birthday.
Mhm.
And, you know, I to this day am still kind of wondering what the long-term effects are going to be. And that's one of the things also that I like a lot about the plant-based diet is that it's so nutrient dense that I'd like to think I'm kind of overloading my system and kind of being able to offset whatever malabsorption issues there may be. I also know that the body is quite resilient and finds a way to absorb more over time if you look at studies like that. But I still don't know long term what kind of risks I'm facing because the data just isn't there yet. And so I think back to being in a position at 13
Mhm.
when it would be the parent making the decision for the child to have weight loss surgery. I just, if I'm that kid and I put myself, I was that kid. I think back to that time and I really wish that somebody would have sat down and had a really in-depth talk about what a healthy diet actually looked like. There is such an ambiguously defined message that is being sent by physicians. It's okay, well, eat a couple more vegetables. And, you
Yeah.
know, and you're lucky sometimes if you get that. I remember being prescribed high blood pressure medication
Mm.
and they were like, "Okay, well, eat a healthier diet with a little bit less salt." And like, give
What
me
does
give
that
me some
mean?
help here.
What does
Right.
that mean?
Right.
Yeah.
And what I've learned doing this show is the doctor doesn't really know either. And
Mhm.
that's a huge problem. That's a enormous problem.
Chuck, you're absolutely right. That is a big part of the problem is that our medical education doesn't emphasize nutrition, and what exactly a healthy plate of food looks like. We were taught as medical students to prescribe lifestyle, diet, and exercise, but most of us don't really know at that stage what that means. And that training is often really not readily available. So we can do so much better in educating future doctors.
Absolutely. Absolutely. Let's see if we can get some practical tips out there for some parents who may be listening right now. They're concerned about their own child and they're wondering, okay, well, what are the foods I should start trying to put on their plate? Like we heard you talk a little bit about the power plate there, but are there some specific fruits or vegetables that you may recommend that they start with to introduce their child into getting more than one serving a day?
Yeah, I would start by asking the kid which one they like. Take them grocery shopping, get them involved. Research has shown the more they're involved in purchasing the food, preparing it, the more invested they are, the more they enjoy it. And, if your kid doesn't like an apple, don't push an apple. If they like watermelon, great. Load up on watermelon. Buy a variety of foods. And really importantly, lead by example. When kids see parents eating a certain way, they're likely to eat that way too. So keep lots of healthy foods around. Kids are growing, they get hungry, they'll eat it.
And I want to go back to the kid maybe who does have weight loss surgery. And we also need to talk about not just the fact that you regain the weight and perhaps you don't change your healthy eating habits. I I think a lot of people overlook the fact that even if your stomach is shrunk down, you were talking about Roux-en-Y. Initially, when the procedure's first done, it's shrunken down to about, or it's partitioned off to about the size of your thumb, right? So
Mhm.
that's your little pouch there when you first get started. But over time, that little thumb is like a balloon and it expands, right?
Mhm.
So after time, you have a pretty healthy sized stomach again. You can work it back to what it was that you were before.
Sure.
It's, it ain't going to be pleasant, but if you're hell bent on eating something, or you're a food addict, and if you're in that position to have that procedure, there's a pretty good chance that you're struggling with that, in my opinion. You can get there. And again, I've seen this time and again. And I remember, and I've told this on the store on the show as well. I remember going for the initial consultation and the doctor telling me that if you regain the weight, don't worry about it because we can always go back and staple your stomach a
Mhm.
second time. And I was just like, what? Like, I was just gobsmacked by that. And so when that then is presented to the patient, the other problem that I see here with this is that it, in some ways, gives the patient permission to, again, ignore making those necessary changes that will enable them to keep the weight off long term. You're
Yeah.
saying, don't worry about it, go right back to the way that you were. We got you a second time.
Absolutely. And I think the real tragedy in all of this is we're not emphasizing nutrition. We're not emphasizing healthy foods. We can do so much. The amount of money we could spend on medications and expensive surgeries, if we could just direct those funds towards changing our food policy, towards encouraging healthier food in schools, in the home, subsidizing healthier foods as opposed to ultra processed foods, I think we could be doing our kids a great service. And then educating the parents, educating the teachers, educating the coaches. It's everywhere. Kids are just constantly inundated by foods that aren't necessarily nutritious.
It's a bombardment, and what alarmed me, one of the graphs that you showed during your presentation was that we've seen, over the last, like 10 years or so, or since the turn of the new millennium here, we've seen an uptick. But the thing
Mhm.
is, I feel like every year we learn more about our health and what is and is not healthy. And yet, despite the fact that we're acquiring this knowledge, we're seeing the trend head in the wrong direction. And I'm just wondering, what is the disconnect there? Are we being so bombarded with these advertisements that no amount of education is going to make a difference because you can't compete with the advertising blitz and the peer pressure and just the customs, the routine you were talking about, just, you know, going out for cheeseburgers or whatever after a swim meet. For us, after football games, we would always go get pizza, or a baseball game, it was always going to get pizza. And if that is continues to be the norm, I don't see anything beginning to change. I think it really starts with changing the way that we look at things and reevaluating things in terms of how we live our lives, the food that we choose to put in our bodies. Until we do that, we're still kind of in a jam here, Doc. We're still going to be in a jam.
We are. And Chuck, I feel for you as a 13-year-old being prescribed blood pressure medication. And I'm thinking, I imagine any 13-year-old out there who's being told, hey, you may need to take medication or get surgery. But I bet if they were told, look, if you can, if we can teach you how to eat more fruits, if we can help you get more fruits and veggies and, more tofu and whole grains in your diet, I think kids would much rather do that. They would do anything to avoid a needle in their arm, let alone have a big surgery. I mean, kids are terrified of needles. So I think we can do so much more to help our kids.
You're telling me. I do know that after I was prescribed the blood pressure medication, I mean, before I went to the pharmacy to fill it, I went through the drive-through. But there was also I almost felt like normal. And in some ways, like, proud of the fact that I was taking this because other people in my family were taking high blood pressure
Mhm.
medication, and now I just felt more like a grown up. Even though it was a sign that something was really, really, really wrong with my health. And I'm not saying that had I been given that knowledge that I have now on that day, that things would have changed right then and there. But I do believe that things perhaps would not have reached the point that they did for me, where I was all of 5 feet 6 inches tall and 420 pounds and like barely able to walk. So I don't want to see any other child be put in that position. And I also, Dr. Rahman, want to make clear, just personally, can't speak on behalf of the organization. I'm not necessarily anti surgery, but I have grave, grave, grave concerns personally about having that procedure at that age. You know, the other thing that strikes me here is the body is still developing, for God's sakes, and you're doing a complete rewiring of it at that point before it's fully developed. Like, how can the body continue to grow when you've transformed it so much on the inside, right? Isn't there some sort of like weird thing that could happen? I'm not a doctor, I couldn't tell you, but it just seems like I don't know about that, you know?
You know, Chuck, in medicine, we talk about making informed choices. So our job is to present information and different options and what are the risks and benefits of each choice, and then have the patient make an informed decision. Well, I think when we're presenting information about medications and surgery, the part that's really missing is about lifestyle changes and how powerful they are, that people can expect to lose weight, they can expect to feel better and do it without really virtually no side effects other than cravings, which will diminish with time. I think we really need to just present those as choices. And I think most families would prefer a simpler approach that involves eating differently rather than taking medications or surgery.
And if nothing else, just lay the price point out in front of them. You know, you're talking about a huge difference between $1,600 or $2,200 a month versus, you know, filling the shopping cart with
Yeah.
healthier groceries. Even with grocery prices going through the roof, I guarantee you, you're not going to come close to that $1,600 mark. It's just not going to happen. It's
No.
just not going to happen. So, I guess I'm kind of optimistic that in the future we will see some improvements here. I think that eventually we're going to have to reach a turning point where even, you know, the person who has nutrition the furthest thing from the forefront of their mind will eventually have to stop and take a look and say, wow, okay, well, we really do have to make some changes now because this, the way that we're going, the way that I've been going, it's just not sustainable.
And you know, Chuck, I think we are making changes. You know, the work that you're doing, that we're doing at the Physicians Committee, the research, the care we're providing in the clinic, we are making a difference. Look at how different the grocery store shelves look now. You know, next to the dairy section, there is a whole non-dairy section full of plant-based alternatives. And in most grocery stores. So I think the change is happening. It's happening slowly, but I think people are appreciating that things need to change. And our job is to just keep educating and getting the message out there so that people who need it the most can benefit from it.
Amen to that. Amen to that. And the last thing that I want to say here today is just to point out once again that, you know, whether you lose weight through bariatric surgery, whether you lose it through an injectable, whether you lose it on a fad diet, the bottom line is the only sustainable way that I personally have found to keep the weight off and what the research shows in terms of long term success is to adopt that whole food plant based diet, right? Just get as many of those ultra processed foods as possible out of your diet. Go for the food the way that nature intended it. Basically, that's the hippie way of saying it, but I don't know of a better way to say it either. So if you eat that way, the weight just naturally is going to stay off and you're going to get all of those nutrients that you need at the same time. And your body's going to thank you for it. And so that's all I got to say about that. I'm going to get off of my soapbox now. And thank you very much for being here, Dr. Rahman. This has been just a phenomenal segment. Thank you so much.
Thank you, Chuck. And thank you for all you're doing to help educate others.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.